Okay, this is surgery number 3 for skills. This is going to be a surgical extraction like a wisdom tooth. So we need the mirror and the explorer. And we're going to extract number 17, which is completely impacted underneath the gum line. We're going to do anesthetic. Keep in mind for this, they might actually have IV sedation. And anesthetic. And we would use more than one cartridge of the anesthetic, so we would have to replenish that probably twice. We want them good and numb. We'll let the patient set 10, 15, 20 minutes. When they come back, we'll make sure that they're numb. If they've had IV sedation, they probably won't be able to tell you for sure if they're numb, but if you see them jump, we'll know that they feel that. And we're going to go to the scalpel. And you are going to leave this in the paper until I grab it. Again, that surgical blade is very sharp. When we're using this scalpel, you will use the low suction or the slide ejector that's surgical. Again, it's metal. We want to keep everything sterile in this case. Slice into the gum tissue. And then the dentist should take care of the scalpel themselves since it is such a sharp instrument. Now I need periosteal elevator. I'm going to flap the gum tissue back away. Now, if it's partially bony or fully bony, there's bone, alveolar bone all around it, so we'll need the surgical burr with the high-speed handpiece. Surgical burr is the really long burr. When we're using that, the assistant will use the surgical HVE. Then we're going to go through the elevators, small straight, medium straight, and large straight. Keep in mind there's also other elevators, depending on what the dentist would prefer. You might have 2 or 3 other ones that you need. Then we'll go through the forceps. The assistant will have the piece of gauze to take that off. And then more than likely it's going to come off in pieces or they'll have to suction the tooth. So we'll use the curette. And we will use the root tip pick if needed. And then check it again. Now a lot of times when we've had to use that surgical burr, there'll be some bone that is sharp and jagged. So we're going to use the rongeur forceps if needed to snip off those sharp pieces of bone. Now, once we're all good, we're going to go ahead and put sutures. Remember, anytime you use a surgical burr or a scalpel, you will need to use sutures. So you pass the dentist the hemostats, and the dentist should grab out the suture. And what the dentist will do is actually stitch up that spot and tie a knot. As the assistant, what you're going to do is come in with the surgical scissors and actually cut right after the knot is placed. This is again very sharp. We don't want it just laying on the tray. So when we are done, it is best to put it back into the same container. And then of course that would go in the sharps container when we're all done. Now at this point we're going to go ahead and put the gauze in their mouth, fold it in half and in half again, and let them bite down. In this case you might need more than one. You certainly change it before the patient leaves. And if they've had IV sedation, we tell the parent or whoever brought them the same instructions about no smoking for 48 hours, no spitting or sucking out of a straw. Those would all cause a dry socket. So that is surgery number 3 for skills.